dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View.
I'm Yvonne Dunetz. Welcome to The Health View. Today our topic is about being a senior citizen in a coronavirus pandemic era and what the challenges and solutions are. My guest today is Henry Quinlan, an 81-year-old semi-retired publisher and author of an upcoming book, How to Build Your Emotional Pension, a non-financial guide to finding meaning, identity, and purpose in retirement. Welcome, Henry.
Thank you, Yvonne.
Let's start out our discussion today about talking about what is emotional pension.
Fine. The emotional pension is a phrase that I have coined or created. And what I mean by that, your emotional pension is the storage port for mental attitudes and strategies for meeting the emotional expected and unexpected issues encountered in the retirement or golden years. So it's those things that you call on within yourself to meet the emotional challenges in this later years.
The interesting thing, Henry, as we all know, is that we're living in unprecedented times with the pandemic. Related to the challenges that people are going through, there are some people that have had to retire earlier than expected because of the end result of the pandemic, and others that already are retired, as well as others that are looking at perhaps retiring sooner versus later. What are the challenges that you see from an emotional pension point of view, as well as just strategies that people can be aware of?
Well, interesting enough, the seniors are better equipped than most. And it's primarily because they've seen a lot of these issues once they start reflecting on their past life. But what comes up with the major issue with seniors and with everyone is dealing with uncertainty. And uncertainty creates fear. And visualize the people you may have done it yourself. You're laying in bed and you're wondering, did I lock the front door tonight or not? And so that anxiety is increased manyfold by the virus. We're all, in times we're quarantined, we're worried about our financial future, or some people worried about will their job still exist. And if you let these fears go rampant, then you become someone who, for instance, checks the stock market every 10 minutes. And it's the anxiety and fear is overpowering you. So what you have to learn is to control these fears. You want to first start out by building your tolerance for uncertainty. One of the key ways of doing that is surround yourself with people who have a similar attitude and are very clever and resourceful in beating back these anxieties. You don't want to surround yourself with people who are moaning and groaning about all the difficulties laying ahead. So you want to build in a little optimism. You want to learn to live in the present. Sometimes you have to bring the fears down right to the moment and say, I am not fearing the loss of the stock market right at this moment. You can't control it. So learn to control what you can control and what you can't. Focus on your own resiliency. We have all lived lives and have encountered dangers in the past, which we have survived using our own resources of being resilient. Call on those skills again. Think back, well, I did this before. This is just another one. Stay connected. Very, very important. We're going to go through this, but stay connected to family, friends. If you live in an apartment building, nothing wrong with walking down the hall, knocking on the door of a neighbor. Stay connected. Work with people. Most important, be proactive. So much of life is being active, proactive for your own survival, and not be passive and just accept everything.
Henry, in this age of really so many questions and perhaps answers not being known, what would you recommend related to critical thinking for people to get the facts and information that they need in order to stay calm and not be anxious?
Critical thinking, there's never been a greater need in my mind for critical thinking skills and to really work on them because facts and truth matter. And this is such a high profile issue that the Harvard commencement in the year 2020 had as its speaker Martin Barron, who was the editor of the Washington Post. And he started off his talk with facts and truth are matters of life and death. Misinformation, disinformation, delusions, and deceit can kill. And we've already seen that where people are getting information not only over the internet, through social media, through newspapers, through radio, through television. So how do we wade through all of this and avoid going down the wrong path and believing the wrong things? So Mr. Barron set out some building blocks of credibility. So first off, when someone's telling you something, you want to look at their education. Do we have a doctor talking about nuclear physics? Or do we have a plumber talking about surgery? So what's the education background? Then you want to talk about experience. Are you talking with a doctor who has 6 months experience or one that 20 years experience? So these are the things you weigh their credibility. Then their expertise. Brain surgeon, and you're having brain surgery, or a GP? Who do you believe? And then what evidence are they presenting? Are they presenting evidence that is relevant? Mm-hmm. So you consider these 4 items in assessing, is this believable? Those are the building blocks for building credibility. Then there's another way of looking at it. Someone is telling you something, say, why are they telling me this? Who benefits? And as an example, I talk about the pharmaceutical company, who about a month ago, the president of the company said he felt duty bound to announce to the world that they were successful in some of their vaccine cases. Of course, he didn't present any evidence, but he made that announcement. 4 days later, you learn the executives in the company, based on the rising stock market, made $30 million. So again, why are they telling me this? And who benefits? So there's the credibility. So this is more important today than ever. And we have so much information that's disinformation. The whole issue of masks, for instance. What does the scientist say? What do the political people say? So it's credibility, and you want to make your decisions based on credible evidence.
Now, on that note, you mentioned before the importance of people being socially active and that it's okay for them to connect with people down the hall. I just want to grab at that point of facts, and that we know that masks, based on scientific information that we've received, can make a difference, as well as social distancing and washing of hands. So those are 3 points that we need our elders and our entire community to remember. You can make a difference. You can be in contact with people on social basis, but be careful. Make sure you wear a mask. Make sure you wash your hands. Make sure you keep social distancing. I think that's an important reminder related to myths and facts and information. As you proceed, though, what you said, I think is very important. We are living in an age right now where it's hard for people to determine the truth or get the facts, or it's caused more and more confusion. Our elderly and senior population, one of the things they need to address right now is information relating to voting. When you think about what's coming up for them in getting the senior flu shot and being able to make sure they get that shot in order for protection. What are your thoughts about this?
Well, one of the things that the internet is really terrific at is providing accurate information, and it's very important that you go where you're going to get the right information. Let's take voting, which is a perfect example. The voting information that directly affects you is from the community where you vote. So you would go online to the city or town clerk's office, and right there you'll find all the information, whether you're going to vote in person or you're going to vote by mail. So go to the source. Always is go to the source of the information. And otherwise, you have to rely on experts. The CDC has a very extensive website that gives you all kinds of up-to-date information about the virus, about wearing a mask, and all the rest of it. And there are many medical institutions, Johns Hopkins being one that has probably the biggest website on about the virus, safety precautions, mask wearing, data, deaths, hospitalizations, the whole thing. So it's go where the information is near the source and is accurate.
And the same related to the need for a flu shot in preparation, to be able to go contact your local physician, your primary care provider, your public health department, and find out in your areas exactly the information there so that you can know how to obtain a shot and to know if a shot is something that would be beneficial for your health and well-being. As we move forward, go ahead.
My own experience on that area, I mean, when talking about with different people that I know, family and friends, about the flu shot, I got all kinds of different opinions. Have it now, have it wait, all the rest of it. But so I went online and just sent an email to my doctor. Should I get it now? Quick answer came back, yes. End of story. Go to the source.
Absolutely. Go to the source. So as we look to the impact of the coronavirus and the pandemic on retirement, what are you seeing? What are people communicating related to the challenges that they're going through?
One of the major things that seniors can do in this era of being isolated and quarantined is staying in touch, various methods. It's very important. I can't emphasize enough to maintaining contact with family and friends. One thing is the basic telephone. Just pick up the telephone. But other ways, there's an enormous number of ways you can do it on social media. The most popular for senior citizens is Facebook, YouTube, and Zoom. These are all easy to operate and very efficient for particularly staying in touch with people. Once a week, I have a Zoom meeting with all my grandkids. So that's one way and that's great with them, and that's a good way of staying in touch. Another big issue for seniors is travel. Seniors are the biggest travelers in the population, but now we've all been set back a while because we're not traveling, but that's not going to last forever. I recently saw Rick Steves talking about it, and his expectation is travel will open up again in the summer of 2021. He said officially it may open up in the spring, but a lot of things have to be worked out. So he recommends waiting till the summer. But if you are going to travel, there are some things you should do. First step, talk to your doctor. Tell him where you want to go and get his advice. Can you do it? Can you physically do it? Is there anything you should be aware of in that particular country? Then you want to check the websites of any airlines, hotels. What kind of resources do they have? If you're going on a cruise ship, you want to check their website. What kind of medical facilities do they have? We have watched all those ships circling around, and we saw that a lot of them had no separate medical facilities. They were just sticking people into staterooms. Do they have a medical staff on board? Some have a nurse, some have a qualified, whatever that means, crew member, and others have a full-time doctor. So you want to make sure that they have it. Then you want to know what kind of an evacuation plan do they have. And lastly, check your insurance. Many people have found that the insurance did not cover cancellation. And that's very critical. You think you're covered, but there's so many exceptions, so make sure you read your policy to know what you're buying. So these are the major issues around fears for seniors. But generally, you want to still maintain and build a life that is rewarding for you, even under these circumstances. Again, we're going to go back to proactive. But let's look at the numbers. What do the numbers tell us? So the numbers tell us that 99% of all information about retirement is financial in nature. Just think of that, 99%. 62 is the average age of retirement. 18 years is the average number of retired years, and that's growing as we're living longer. Here is the big one, 200. 200 hours a month. Those are the hours you've previously used to work and commute to and from work. So if you are not working and you're retired, you look at 200 hours. These are the hours you have to fill. I'm not suggesting that you put a timesheet down and fill all those 200 hours, but that gives you an idea of planning, that you want to stay busy and stay active. 31.5% of seniors had been treated for depression. That was a study in 2019, the state of Massachusetts. On first look, the number 31.5% is really it shocked me. But then as I read more, seniors are the most apt to be dealing with death of a loved one. That certainly can cause depression. Mm-hmm. They're most apt to be dealing with some health issues, taking drugs, all of these combined. So depression is a major issue in your senior years. 43% of seniors have reported being lonely. So here are the two, loneliness, depression. They sometimes go hand in hand. So again, loneliness, but there are ways out of it. There are ways to get through it. There are websites that can help you gain new friends. I gave this talk at down in Massachusetts at Wellesley Senior Center, and a man came and he looked at me and he said, "I've come here because all my friends have died. I want you to tell me how to make new friends." And that basic human skill, but it calls for proactive. So the major areas of concern in the senior years, you're going to look at depression. Loss of identity is a big one. If you were formerly someone particularly with power, you retire, you don't have that power anymore. And a lot of people have a very hard time. For instance, many law enforcement people are used to telling people to move. They're retired now and they tell people to move, and people look at them and say, "Who the hell are you?" Historically, police officers have had a shortened retirement because of issues surrounding they can't deal with loss of identity. And a lot of men can't deal with loss of identity when they're no longer the breadwinner. Their wife may have started a new career at 50, 55, so they're ascending and the man is going down and he's no longer the breadwinner. Whatever your identity was, it was. You got to look at that. It's over. It's past. You've got to look forward. And the only way you're going to begin to look forward is to get rid of any misthought you had about holding on to your identity. That's not who you are. Don't be defined by your identity. Some of the things you can look at is some people who all they talk about is former work. They tend to associate with former fellow employees, and they haven't moved on. So it's very important that to move on into your retirement and start building something positive, let go of the past. Loneliness is a big issue. And one of the reasons that I talk about that is many people are afraid to build a new life. They don't know how. And I had another man come and talk to me at one of these talks that I give. And he didn't know what to do. And he said, my wife, in his words, kicked me out of the house this morning. He said, go down and see him, see if he can tell you anything you can learn. You have to be proactive in building a new life and a new identity. Boredom is a big, big issue in retirement. Big issue. If there's one thing that I've heard from many, many people, it's they're bored. And so the guy that says, well, I'm going to play golf every day. And after 2 years, he's played golf every day. And then he said, well, it's got to be more than this. So boredom sets in. Boredom can really rot. So again, you have to get outside of yourself and be proactive. If you don't, it becomes negative energy. And you're just sitting at home feeling sorry for yourself. Another comment that I hear often is, I wish I had this information before I retired. Because people have focused so much, well, I got my finances in order, then this is going to be a piece of cake. Sometimes it isn't. Some people say, well, I was very successful in life. I'll be successful here. Different skill set. You're building a new life, new agenda, new activities. If there's one thing I can tell seniors in the retirement years that is most helpful that I've seen, it is learning a new skill. I don't care how small it is, but learning that new skill can bring you such a great sense of satisfaction. I'm talking about this, and another one, a woman jumped up and said, do you know what I did? I said, I have no idea. She said, I learned to play pool, and now I beat everyone here. I said, and you could just see the pride and the smile on her face. She was really accomplishing something. There was recently a very special program, I thought, on Channel 2 called Brain Fitness. And they found that seniors who increased their memory by exercise learn something, which I talk about, learning a new skill, that equals happiness. And those two, it's so important. And the other thing that there's a difference between men and women. It is not uncommon for me to give these talks, and the audience is 100% women. And the statement that they all say at the end of it is, my husband should be here. Men have a much more difficult time in retirement than women. Women are social, they're more outgoing. Men, it's a struggle. So let me give you an example of a friend of mine. So he retired from a major position in a corporation. And when he did, he and his wife divorced. She was on her way up in her career and he was retired. So he got over that and he bought a home down in the Hamptons in New York. And I called him one day and I said, well, how's retirement treating you? He said, it's okay in the beginning, but now I'm bored. What am I going to do? I said, well, you got to do something. He said, well, I don't want to do anything. And I said, well, that's okay. That's what your choice is. And so we chit-chatted, and I said, well, I'm going to check in with you in about 6 months. So I called him back in 6 months, and his voice had a whole new tone to it. He was very happy. He said, you'll never guess what I did. I said, I have no idea. He said, I got bored so much. He said, I was looking in the newspaper and I saw there was a job for a doorman at one of the resorts down here. And he said, by God, I went down and applied for it and I got the job. And he said, it is great. I'm working 30 hours a week. I meet people every day. I make a few bucks, not that I need it, but it just is all good. And he says, it's really put a new step into my life. And there's an example. Get outside of yourself. And as the old phrase, put your ego in your pocket and think about just enjoying yourself. So that's just one story of many who people are navigating in a different way. And everyone is different. So the trick is to find what makes you good. And then when you start, the executive, whatever, he'll say, I always wanted to write. And I've met those people. And I've worked with one man, he's on his third book now. He found his passion. And when you're in the senior years, this is the time to find your passion and do it. You have the time. And if you have your health, health underlies everything. But if you have your health, you have the time, and find out what fits you financially, that's the way to do it. Find your passion. How do you find your passion? Think back in your life at those moments when you're talking or doing something and time is not an issue and you're just being there. And that gives you a little hint as to what you are. So pursue that, discover that, who you are. Sometimes it's trial and error, but that's okay. It's all part of it. Find who you are, find your passion, and do it. And you're going to build yourself a wonderful retirement.
And Henry, one of the passions that you have are helping people write their stories,
Right.
Stories about their life. So if people are interested in doing that, they can get a hold of you at the website, which is right underneath your name on the border of ours. And you're at www.hmqpublisher.com.
Correct.
And you can help them to write their story. In a summarization, I don't want to lose this. It's really important for people to be in contact with their medical professionals in order to help them with their health and well-being, not only physically, but also from a mental health point of view. Depression is something in isolation that people are going through, that there are resources available for you to help you. So contact your medical professionals so that they can support people and help them out in that regard. Again, to be safe, to know that there are ways through the internet that people can learn. When you were saying about travel and things like that, even though people cannot do that right now, they can use the internet to explore wonderful places to see and do and learn about other things, plus take classes online and to explore different topics that they have not been able to do. So there's a silver lining in all that we go through. And the key is to be proactive, to be active in other ways that perhaps you haven't been able to do before because of the pandemic, but not to stop being connected with people, being in touch with people, and being able to communicate in the best way possible. Henry, it has been wonderful having you on the show. I know it's a very meaningful time, and the information that you shared will be welcomed by many people. I thank you very much. May we all be healthy. May we all be safe. May we all live at ease. And may we all do everything we can to support one another. Be well and take care.
Thank you. Thank you very much.